Welcome back to Treasure Valley. Again with me is a Treasure Valley View alum, Dr. Karlfeldt. And when he was with us last time, we were talking about a little bit about weight loss and what your homeopathic methods actually help with. Is that correct?
That's absolutely correct, yeah.
I have some amnesia, so I can't remember everything.
Well, we were talking a little bit about weight loss, what you can do for weight loss, talking a little bit about female hormonal issues.
Oh, that's right.
And what to do with that, whether you're past the age of 50 or prior to the age of 50, when prior to menopause.
And all of those things make great, big, huge differences. And what we'll be talking about today, y'all, is fibromyalgia, which is I'm hearing a lot more about fibromyalgia than ever, and all the medications that are involved and the doctor's visits and the side effects. So I'm certain that you've got some amazing things to share with us that would definitely help in so many better and more healthy ways.
Well, the fibromyalgia was something that created a lot of frustration with a lot of people in the past, because they went to doctors who were dealing with all this pain. They were fatigued, they couldn't sleep, they were depressed, anxious, they may be dealing with like irritable bowel syndrome, they may be dealing with all these different issues, and they were going to a doctor was taking blood tests, and nothing was showing up. So then the doctor was saying, well, it's just all in your head. So it's a psychiatric disorder, so just let's give you some antidepressants or something just to make you be quiet.
Well, how in the sound, okay, because just from that alone, it sounded like there were 17 different symptoms of something. And if you have all of those symptoms, how in the SAMHEC can a doctor say, well, you're making it up that you can't go to the bathroom?
Yeah.
You're making it up that you can't sleep.
And that's in essence, that's what happened. So you have all these people that were suffering in pain, they couldn't work, and they were told by the doctor that there's nothing wrong with them. They were picture healthy. And they have since then, though, come up with a classification of what fibromyalgia is. They still don't know the cause, but they
Well, what are they classifying it as?
Well, they're classifying it as a syndrome, which means that they have all these different symptoms, and if you have this set of symptoms, then you are someone that may have fibromyalgia.
And then weren't you telling me that fibromyalgia, you have to have pain in 4 quadrants as opposed to just like one area, and that's one of the telltale signs of fibromyalgia?
Correct, yeah, it needs to be in all 4 quadrants of the body. Also, you have 18 trigger points that spread out through the body that they've recognized, and you need to have extreme sensitivity on at least 11 of those trigger points.
Okay, so there's a lot that goes into actually figuring out that it is fibromyalgia and not just something, but it is something real. It's not something that's in your head, and it's certainly not something that a simple antidepressant will take care of.
Absolutely.
Okay,
not.
so since we've already discussed what it is, what it could be, how we get there. Now let's talk a little bit about what you do to help treat that and in a healthier manner.
So what I do, I have a person that coming in and they're expressing symptoms that then would look like fibromyalgia, or they may have been diagnosed by their medical doctor saying that I have fibromyalgia.
Sure.
So then I would utilize a technique. It's a biofeedback technique called autonomic response testing that then measures the changes in the autonomic nervous system when you apply stress factors on it. And stress factors can be like heavy metal, can be a chemical, it can be a food. Commonly what happens when you're dealing with fibromyalgia is that there are a lot of food sensitivities.
Okay.
So for instance, if you cut out things like gluten.
I was going to say gluten seems to be the sneaky factor in a lot of things.
It is a huge factor. I've had patients that come in and all I do, cut out the gluten and the pain just goes away.
Holy Hannah. Okay.
Yeah.
So, and then from that point forward is you do the tests, you diagnose it, and then you come up with then a treatment plan. Is that correct?
Exactly. So I put together, depending on my findings, so it may be that there's an imbalance in the pituitary. Pituitary is like the CEO of the whole hormonal system.
Oh, wow.
Or it may be the adrenals. Frequently when you're dealing with fibromyalgia, it's a combination also of post-traumatic stress disorder. Syndrome, exactly. Or it may be that you've gone through very stressful events.
So stress can cause or lead to fibromyalgia as well?
Hugely. So it can create then a dysregulation in the whole hormonal system. And
not that I have a whole lot of time, but have you noted that a lot more people are coming in with fibromyalgia, with this depression, with the economy the way it is? I mean, is that more predominant now?
So you have feelings like helplessness and anxiety and stress at work, Also stress overall in regards to financial stress,
Sure.
the economy, what's going on in the nation and the world, etc. All these have an impact on the symptoms of fibromyalgia. So they've seen that the pain levels actually increase when a person is dealing with all these issues.
Okay, so doctor, why don't we go ahead and let everybody know if you feel like you have these symptoms or if you'd like to schedule an appointment to have a consultation with Dr. Karlfeldt, please go ahead, and where should we get a hold of you?
So the best way is to call my office, which is 208-338-8902, and you can schedule an appointment. And what I've done actually, with the people that are watching this show, I'm offering a free evaluation.
Oh, holy Hannah, that's great.
So you get a free 30-minute evaluation. All you do is just call my office and then say that I saw you at the View and I want to schedule my free evaluation, and we'll get you in.
That's an amazing opportunity. As a matter of fact, you know what? I'm going to call the office. I'd like for you to schedule an appointment, and maybe you could tell me everything that's either right or more things than right. I'm practically like Mary Poppins, perfect in every way. But I think that's fantastic. Thank you again for coming on. We will definitely have you come on with another agenda in the very near future, because there's a lot of things that you can heal yourself naturally. Your body is made to heal itself, along with a little bit of help from Dr. Michael Karlfeldt.
Thank you very much.
Well, thank you very much for having us. We'll be right back to Treasure Valley right after these short commercial breaks.